It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. It's Julie from Morton Hospital welcoming you to another episode of Morton in the Morning, your weekly radio show, broadcasting live from Morton Hospital, your community hospital in Taunton. And we come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. We're so excited you're joining us today. We have a new episode lined up for you. It's Breast Cancer Awareness Month, so today we'll be speaking with one of our specialists about our breast care program here at Morton Hospital and all about breast cancer screening guidelines, treatment options, and so much more. But first, before we get into that, we are also celebrating a few other recognition weeks here at Morton Hospital. This week we are celebrating Pharmacy Week as well as Pharmacy Tech Day. We are celebrating Medical Assistance Recognition Week. And lastly, we are celebrating Quality Week and Infection Prevention Week. So shout out to our quality team, the MAs within our hospital and also across our affiliated medical offices out in the community. And to our entire pharmacy team, we appreciate you. Thank you so much for all you do for our team, for our patients, and for our community. So if you couldn't tell, we do a lot of celebrating at Morton Hospital. Recognizing our staff in all these various appreciation events is really important to us, and that's just part of our culture, and it's one reason why Morton Hospital is such a great place to work. And we are actually hiring. Right now we're trying to grow our team. So if you are interested in joining us here at Morton Hospital, we also have some other incentives. So we have a sign-on bonus right now running through mid-November, and it's for various nursing positions at Morton Hospital. So right now we are looking for experienced nurses, which is a minimum of 2 years, to hire into full-time and part-time positions in various departments at Morton Hospital. So for our sign-on bonus, again, which is available through November 13th, we are looking for nurses for our Elder Behavioral Health Services unit, our emergency department, our M2, S2, and S1 units, which are our medical surgical units, and also for our MORCAP unit, which is going to be our new substance use disorders treatment unit here at the hospital. And any candidates that are signed on and hired into full-time positions in those areas for nursing are eligible for a $6,000 sign-on bonus for a full-time position and a $4,000 sign-on bonus for part-time positions. And we're also looking for nurses for our intensive care unit, so our ICU. So full-time positions are eligible for a $10,000 sign-on bonus, and part-time are eligible for a $6,000 sign-on bonus. And of course, we want to take care of our employees as well. So any of our current employees who refer someone to one of those positions, and if that person is hired, our employees are also eligible for a sign-on bonus. So we love internal referrals. We love when our team and our community refers people to join our team at Morton Hospital. We have several positions available. And not just in nursing, but many other positions in ancillary areas in the hospital, safety sitters, nursing assistants, admitting clerks, food service aides. So if you go to our website, you can go to mortonhospital.org and check out the careers page, or go to jobs.steward.org. And you can search by location Morton Hospital and browse all of the career opportunities that we have available. And you can also apply online. So please take a look and share with friends, family, colleagues, anyone who may be interested in a new career opportunity, Morton Hospital is a great place to work, and we have that incredible incentive right now, a sign-on bonus for various nursing positions. With that said, we have a great show, like I said, lined up for you today, and a lot of good information to come. So let's kick off today's show. So today we are so happy to be interviewing over the phone Dr. Patricia Andrade, who is one of our general surgeons with our Morton Surgical Group, and she specializes in breast surgery. Dr. Andrade, thank you for joining us.
You're welcome. Thank you for having me.
Okay, so I think this is the first time that you've been on our show, so I'd love to have you start by telling our listeners a bit about yourself and your background.
Yeah, sure. So I am a trained general surgeon. I've been in practice for over 20-something years, and have been in the Morton, Taunton area for the last 4 years and a half. And I trained in general surgery. I do both general surgery, but I have a specialty interest in breast practice, both for breast benign issues, but also for the management of, breast cancer type issues and other breast problems. And I work in both both in the Taunton market, but also recently in the Fall River market. In doing just breast in that area as well.
Okay, well, you're certainly in high demand. So tell us a bit about the team here in the Morton market here at
Sure.
Morton Surgical.
Yeah, so we are so fortunate in the Taunton area to have a very comprehensive group of general surgeons at the Steward Medical Group, Morton Surgical Group. There are 4 of us, general surgeons, and each of us actually have, we all do general surgery, but we each have a very area of specialty that we can focus on, and so we're able to really serve the community in a very comprehensive way, and we all work very well together and collaboratively with other primary care doctors in the group in the area. So it's actually it's really an ideal type of a practice to be able to offer patients a wide variety of surgical services.
Excellent. Yes, I mean, I think, some of the members of our practice are pretty well known. Obviously, Dr. Thayer, who has been in this community for quite some time, and Dr. Bodner, who also does weight loss surgery. And then both
Correct.
you and Dr. Demopoulos joined our team around the same time. It has to have been maybe 2 or 3 years now, or has it been longer?
It's actually 4.
Oh,
it's
my
actually 4.5
goodness.
years, yes.
Okay.
Dr. Demopoulos does high acuity or very complex laparoscopic colorectal surgery, and Dr. Bodner and Dr. Pecue have been working very hard to develop the bariatric surgical program, which is actually doing quite well in our market.
Absolutely, and that just earned national accreditation, which we are really excited about.
We are, yeah.
So, Dr. Andrade, I have many more questions for you. I want to learn a little bit more about your background and what interested you in the field of general surgery and the specialty of breast surgery. Also want to talk a lot more about our program here and talk about some guidelines for women out there with regard to screening. But first, it is time for us to take our first commercial break of today's show. Before we do, I'd like to remind our listeners how you can contact us here at Morton Hospital, Morton in the Morning show. We have a special email address set up for you, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And you can email us any feedback about our shows, any suggestions for upcoming shows, topics you'd like to hear about, or any questions or follow-up questions you have on any of the shows that we've aired, or just any questions in general. We would love to hear from our listeners if you want to let us know how we're doing. So it's mortoninthemorning@steward.org. When we return from our break, we will be back with more with Dr. Patricia Andrade, talking a bit more about Breast Cancer Awareness Month and the importance of screening for early detection and many other topics. So stay tuned. We'll be right back after this commercial break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. I'm your host, Julie, and today I'm so happy to be interviewing Dr. Patricia Andrade, who is a general surgeon specializing in breast surgery here at Morton Hospital, and she's been part of our team for the last 4 years now. And she practices at our Steward Medical Group Morton Surgical Office right over in the Thayer Building at Morton Hospital. So this is Breast Cancer Awareness Month, and we have a lot of questions for Dr. Andrade. But first, I just have some more questions about your background. So tell me, what drew you to specialize in breast surgery?
So when I first started practicing, my interest was not in breast, although in my training I always enjoyed the management of the cancer patient. And so when I started practicing, it gave me an opportunity to really develop that interest in managing cancer patients, but also being a woman and being a woman surgeon. My practice began to evolve heavily seeing women, and women were more comfortable seeing a woman surgeon. And so those two kind of issues meshed into, and they met my interest as well, and they meshed into a niche that was needed. So over the years, I've spent a lot of my surgical education and in honing in on the state-of-the-art breast practice and the latest technologies. And I also enjoy the ability to relate to women and to take care of women in a medical setting, which over the years it's become better, but a long time ago women were not really accounted for or given credibility both as patients and physicians. So it's actually been a great evolution of and progress in time where women are thought of in a much better way.
That's great. Well, we've been certainly very fortunate to have you part of our team. And just as Dr. Bodner and Dr. Pecue have played a huge role in growing our bariatric program, you have certainly played a huge role in growing our breast program. And we'll talk a little bit about that later. But I do want to start with some general advice, because we're talking to you. It's good timing. It's actually Breast Cancer Awareness Month, and we always want women to focus on their breast health. So maybe just some general questions for you. Obviously not medical advice, but some general guidelines. So what are the current mammography screening recommendations? Because I know they've changed year over year.
They have, and it becomes very confusing to both practitioners and to patients with these changing recommendations. But in general, the recommendation is women who are in average risk, and the risk for breast cancer for the average woman is 1 in 8. So the standard recommendations for most insurance companies and most practice settings is for women to start screening mammogram at age 40, and then yearly thereafter. When you're looking at patients who either have a primary relative, like a mother with breast cancer, we subtract 10 from the age the mother was diagnosed, and that's the age that the daughter should be screened, should start screening. So, but in those particular situations, it's a case-by-case basis in terms of what age women should start screening. But in general, it's age 40, and every year after that. And there still is confusion about breast self-exams, but I am a big proponent of women doing their own breast self-exams because it's important for people to be familiar with their bodies.
Yep.
And it's that the breast self-exam is nothing more than that. It's just being familiar with your breast so that when something changes and something is new, then you know, oh, I better go and seek some attention. I better go and have this worked up.
Okay.
You're the best person to know when something is new if you do it on a regular basis.
Absolutely. So why is early detection through screening mammograms, through self-exams, why is it so important?
So early detection is so important because the type of surgery and the type of treatments that are available have a much better success rate in terms of long-term survival and disease-free survival. When a problem is identified on mammogram, oftentimes on a routine mammogram you can identify something that's actually precancerous, and so when you address a precancerous issue that was found on routine mammogram, when that's taken care of, you've actually prevented a cancer from forming. In some cases, it's by a 50% opportunity. And so when you have early detection, very minimal surgery and minimal treatments are all that's necessary in terms of eradicating the tumor and giving women the preventative treatment that they need. And so most of their treatment is actually for prevention and not really for treatment. And so, doing regular mammograms will catch these findings that are either precancerous or early cancer, and the treatment course is a much shorter, much easier, and much more highly successful.
Okay. And now if something concerning is found, through a screening mammogram, what is the next step? And I was also going to ask about the breast care team, but these questions might be combined because there's so many people that could play a role in treating something concerning. So maybe you could sort of walk through what the steps are and who is part of our team and who may be involved in that care.
Sure. So one of the things that I'm really excited about at the Morton Hospital and in the Taunton market is the nurse navigator program that we've really instituted. It got like everything else, it got derailed by COVID, but it's back up and running again. And the nurse navigator program is at our hospital level, it's really to navigate patients through that diagnostic time period. So if a problem is identified on a patient's screening mammogram, that there is a person who actually will filter and queue those mammograms and contact the patient as soon as possible to get them in for additional studies. There are a lot of most of those patients who get called in for additional studies actually need nothing else. But it's nice to know that there's actually a person who's going through each one of those studies and determining, along with the radiologist, who needs anything further, whether it's a 6-month follow-up or whether it's a biopsy. And that's where the diagnostic navigator program comes into play. So if a patient has a problem identified either on mammogram or ultrasound, they get their diagnostic workup, they need the navigator, and the navigator is the person who is a liaison contact person to help calm fears, explain procedures, and get them so that they can get as quickly as possible go from their screening to a final resolution of diagnosis.
Okay.
And that's a great program that we've we've got resurrected after COVID. And so, because when there's a problem identified, there often needs to be additional studies. And just because it's additional studies doesn't mean there's something bad, but it just means there needs to be more clarification. Sometimes that's by mammogram additional studies, sometimes it's by ultrasound additional studies, and sometimes there needs to be a biopsy to define what exactly is going on. But all of those components are available and part of our breast care initial program.
Okay. And who else is part of the, extended breast care team? What providers and specialists would that be?
Right. So in the event that a person is diagnosed with a breast cancer, on their diagnostic biopsy workup, then they get seen by the surgeon. But they're also, we have a multidisciplinary tumor board that meets just about every week, and all new breast cancer cases are presented at this multidisciplinary tumor board. At that tumor board, it's a collaboration between radiology, so we're able to look at patients, everyone looks at patients' images and sees what's going on. Pathology shows slides of the tumors. The medical oncologists are there, and they are actually there to hear and to weigh in on what they might recommend for the patient's care. The surgeons participate, and even radiation oncology participates in this tumor board, because specifically for breast cancer, I like to explain that it's a three-legged stool. You have surgery, you have radiation, and you have medical oncology, radiation oncology. A person may not need all three, but at least all three of those specialists communicate very well with one another. We communicate through this tumor board and make a consensus treatment plan specifically for each particular patient. And so that's the overall team. So it's radiology, pathology, medical oncology, radiation oncology, and surgery are the sort of overall pieces of this treatment team that come together and tailor a patient's treatment plan.
Okay. Well, it sounds like we have the full complement of services available right here at Morton Hospital, and a large and experienced team to care for people when they are experiencing issues. So thank you for that overview. And I do want to get more into talking about specific surgical treatment options, because obviously that's the area that you specialize in and working with the whole breast care team. Before we do that, we do have to take another break because we are almost halfway through our show already. We hope you've been enjoying listening to our discussion with Dr. Patricia Andrade, general surgeon specializing in breast surgery here at Morton Hospital. And we are speaking with Dr. Andrade in honor of Breast Cancer Awareness Month, because we really want to get information out there to women and men in our community about the importance of screening for early detection, about what happens when you have when you're diagnosed with breast cancer or other breast conditions, and what the treatment options are available to you right here in our community. So we appreciate Dr. Andrade being here with us today, and we have much more to discuss with her when we return. So we hope you will stick around for the second half of today's show. We will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome to the second half of today's Morton in the Morning show. I'm your host, Julie, and we are coming to you right here from Morton Hospital in Taunton. Today, we are recognizing Breast Cancer Awareness Month, not just today, but all month. And it should be something that's top of mind for everyone year-round because as we've been talking with Dr. Patricia Andrade, being aware of your breast health and any changes as well as early detection through screenings is so important. And before we took our last break, we were talking with Dr. Andrade a bit about her background, and she was talking to us about the full breast care team, which includes many providers, specialists, nurse navigators, and others who help women navigate their journey from screening through treatment. And Dr. Andrade, as you know, as we had been discussing, is a surgeon. So we want to talk a little bit more about surgical techniques that are available because there are many different treatment options. And as Dr. Andrade explained, sometimes it's a combination of all the various treatment options. Sometimes it's one, but it really depends on what is best for the individual patient. And now when the best treatment is identified, when surgery is identified as the best treatment options, are there different types of surgery and which do we perform most often here at Morton?
Yes, that's a great question. So in general, if you break it down very simplistically, there are either a patient does, I call it a partial mastectomy, people call it a lumpectomy, which is it's called breast conservation surgery, which means that the tumor is successfully removed and the breast is preserved. And then the other option, surgical option, is mastectomy. And mastectomy can actually be done with or without reconstruction. We do have a plastic surgeon that has privileges at Morton Hospital, and we've been able to do some plastic surgery reconstructive cases at Morton Hospital, which is another great addition to the service line. So we, in one major progress that we've recently made at Morton Hospital is doing what we call wire-free surgery. So before, when a woman had a lesion that you could not feel, there needed to be a wire placed into the lesion for the surgeon to be able to find where the problem is. Well, now we have this, we've embraced this new technology where instead of putting a wire on the day of surgery, which creates a lot of anxiety for the patient having to go to mammogram and get a wire put in, now we can put in these little localizing devices that we use a special device in the operating room to be able to find it, and that allows for a very smooth progress in terms of being able to accurately find the tumor, remove it, and have the patient go home the same day. We do also sentinel lymph node procedure, which has been done for more than 20 years, which is a way of just identifying just a couple of lymph nodes that need to be removed in terms of completing the patient's staging process. So we really have adopted and are embracing all of the state-of-the-art kind of surgical procedures to afford patients the real state-of-the-art care at Morton Hospital. And so it really is, some of it is a patient's choice in terms of whether they do breast conservation or whether they have a mastectomy. And so obviously some of it is based on their tumor features and those other clinical features. But in general, the whole consultation that happens between me, the surgeon, and the patient is looking at all of the pieces in terms of the size of their tumor, what the patient's personal wishes are in terms of their body, and what is the safest thing to get them to complete resolution are all of the things that we do at each of these consultations, whether it's with me, the surgeon, or the medical oncologist, or the radiation oncologist.
Okay. And with regard to surgery, when women do have a choice, how do you help them make the best choice for them?
Well, I try and help them think about where they want to be in 5 years. Unfortunately, what happens when people hear cancer, whether it's breast or anything else, they just, get it over with, get it off. But there's so many treatments that we do now that have a significant benefit in terms of disease reduction, whether it's a hormonal pill and radiation, that removing a breast just because the tumor's there is not always necessary. And so I try to get patients to understand their particular situation and in their heart of hearts what they would like to do, not out of fear, but out of education. I try and help patients make the decision from an informed place as opposed to from a place of fear. So, and that's one of the things that I like the most about taking care of breast cancer patients is that I can really help the patient sort of navigate through these decision trees and give them knowledge and give them information so that they can actually make an informed decision.
Okay. And what would you say is most rewarding about the work that you do?
I think what's most rewarding is being able to calm a patient who comes in with such fear that they're going to die and that they're going to lose their breath, and be able to get them through their treatment and help them realize that, it wasn't all that I expected, or they had expected some horrific treatment course, and when I get them when they get to the point where they go, I'm just an autopilot now, that's the most gratifying, is to be able to help a patient make the best decision for themselves and to give them the encouragement that we can take care of this. This is easily managed. This is well managed, especially in their own community, that we have all the resources that patients need. There are peculiar situations where people need to go into a tertiary center where there's higher levels of studies, but majority of breast cancer cases, we have everything that we need. And so being able to have a patient get their surgery, have their family take them home the same day, help them recover in their own community, and everything done here, I think that's one of the most gratifying parts of what I do.
Absolutely. Well, you have certainly shared a lot of helpful information with us today. Before we end our time with you, is there anything else you'd like women to know about our program or what we offer here at Morton?
Sure. I think the most important thing is that we are committed to staying current. We're committed to being ahead of the curve and offering the latest and greatest and most successful treatments for breast patients, all patients, but for this particular conversation, we're talking about breast patients, that in our community we can take care of patients when something like this happens. Nobody likes to hear that they have this diagnosis of breast cancer, but it's not the end of their life. It's not the end of the world. It's absolutely well managed, and we've got the whole team and support systems in place, and we are maintaining, currency and trying to stay current with the latest technology so that patients have everything that they could need in this community.
Okay. Well, wonderful. Thank you again for all this information, and also again for everything that you've done to help grow our program here at Morton Hospital. Like you said, we have everything that women need right here in our community,
Right.
and a wonderful and comprehensive and multidisciplinary team. So many people are involved in caring for women or anyone diagnosed with any breast conditions or breast cancers.
Right.
So.
Exactly.
Well, we really appreciate you and the important role that you play, and thank you so much for taking the time to be with us today.
Thank you for having me, and thank you for your recognizing Breast Cancer Awareness Month. It's only 1 month, but it's an important thing to review to review with the community.
Absolutely, and to raise awareness. We're always trying to raise awareness. So, thank you so much, Dr. Andrade.
Okay, you're welcome.
All right. Well, what a great show. Thank you so much again to Dr. Andrade for her time. We covered a lot, and it was a nice summary of the breast care services that we have available right here at Morton Hospital. And, some information about screening guidelines. And as Dr. Andrade mentioned, screening mammograms are recommended for women ages 40 and older, sometimes a bit earlier if there is a family history or other reasons, but screening is so important. And if you are due for your annual screening mammogram, or if a loved one is, we offer screening mammograms through Morton Hospital at 2 convenient locations. One right here at the hospital in Taunton in our mammography department, and another in Middleborough at our Middleborough imaging site. And they also accept walk-in appointments. But if you would like to call to schedule an appointment with our mammography team, if you are due for your annual screening mammogram, you can give us our central scheduling department a call. And the number is 508-828-7690. That's 508-828-7690. And that is for our scheduling department if you'd like to make an appointment for a screening mammogram at Morton Hospital. And our screening location right at the hospital also offers some really convenient hours, early morning hours, as well as some evening hours on certain days. So if you'd like to view the full hours and more about our department, you can go to our website, which is mortonhospital.org. And earlier in the show, I mentioned that we are celebrating a variety of recognition months this month, from Quality Week to Pharmacy Week. But again, this whole month is Breast Cancer Awareness Month, and it's an opportunity for us not only to raise awareness, but to also recognize our entire breast care team, and that is from our mammography department to our pathology team, to our surgeons, to our radiologists. We have an incredible team, and they really do a great job and offer some important services right here in our community for women and for individuals experiencing breast health issues. So thank you to our entire breast care team. So it is now time for the final break of today's show, but when we return, I have a few hospital updates to share. So if you want to stick around, we'll be back after these short messages with more Morton in the Morning. Stay tuned. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. If you're just tuning in, We had a great discussion today with Dr. Patricia Andrade, who is a general surgeon specializing in breast surgery here at Morton Hospital. And we covered a variety of topics relating to breast health and breast cancer awareness and treatment options that are available right here in our community. If you're just tuning in and you missed our show, you can watch for the recordings of our show. We post the link on our Facebook page, which is facebook.com/Morton Hospital MA. So you can check out our show there. You can also find it on YouTube if you search Morton in the Morning. It's a great show that you don't want to miss. Thank you again to Dr. Patricia Andrade for joining us today. We learned a lot of great information. And as I mentioned before the break, if you are due for your annual screening mammogram, we offer those at 2 convenient locations, one right here in the hospital, down in our Thayer building, and also one over in Middleborough at that satellite imaging site that we have. And you can call to schedule an appointment by calling our scheduling department at 508-828-7690. Our Middleborough site also accepts walk-ins for mammograms, so you can always go there as well. And you can learn more about our breast care services at mortonhospital.org. So we will end our show today with a few hospital updates. First, as I mentioned at the beginning of today's show, we are hiring at Morton Hospital. We have a lot of great opportunities and we are looking to grow our team. So if you or anyone you know is looking for a new career opportunity, we have many available and we have a great team here, a great culture. It's a wonderful place to work. So I highly recommend you check out what we have available. You can take a look at our jobs at jobs.steward.org and search by Morton Hospital, or go to mortonhospital.org, which is our direct website, and you can go to the careers page from there. We have a variety of positions available, from clinical positions, including nurses and certified nursing assistants, to support staff, from environmental services to food services, and many other areas. So another great incentive that I mentioned earlier is that right now we have a sign-on bonus available for various nursing positions. So anyone hired into our emergency department, our geriatric behavioral health department, any of our medical surgical units, or our MORCAP substance use disorders treatment unit that will be opening in the very near future. Those candidates, if they're hired for full-time or part-time positions, are eligible for a great sign-on bonus. And you can learn more about that when you apply or by contacting our Human Resources Department. And then speaking of our MORCAP unit, so we are so excited to be opening that unit very soon. It is a much needed unit. It will be a 32-bed substance use disorder treatment unit. We'll have an inpatient component as well as an intensive outpatient program. And we are looking to grow that team as well. We just this past week had some dedicated hiring events to fill various positions on our MORCAP unit. From nursing positions to mental health associates, to counselors and unit clerks. Lots of great opportunities available there. And fortunately, we already have an identified medical director for that unit. And soon we are so excited to be welcoming Dr. Patricia DeLima to our team at Morton Hospital. She will be our medical director for the MORCAP unit. She's very passionate about helping others and making a difference, and she specializes in addiction medicine. And, you may have already heard her name because she's already been meeting with our community partners and out meeting and greeting in our community and talking about the unit that we are so excited to be opening in the near future. So watch for updates on that, on our website, on our Facebook page, and at various events that we'll be speaking at out in the community. Also, early in the show, we mentioned our Center for Weight Control, our bariatric program, which is now nationally accredited, which is growing every day. We, as part of that program, offer monthly free virtual info sessions and support groups. So those happen on the last Wednesday of every month from 3 to 4 p.m. Again, it is virtual. It's via Zoom. And during that program, members of our Center for Weight Control team talk about weight loss surgery and what's available at Morton Hospital, both medical and surgical options. But they also cover a different nutrition or related topic each month that varies month to month, so that you can gain some support if you have already had surgery or if you are trying to maintain your weight loss. It's a really great session to participate in. So if you would like to learn more about that or sign up, you can sign up online. Go to our website and search for our events and classes page. You can find the link to sign up on our Facebook page, or you can call our Center for Weight Control directly at 508-301-2434. That's 508-301-2434. And we have a great team of bariatric weight loss surgeons. Our office is located right across the street from Morton Hospital in the Liberty Medical Building at 91 Washington Street. And they offer a variety of medical and surgical options, as well as those monthly info sessions. So if you want to just learn more, if you're, just curious about weight loss surgery, want to know what it's all about, and if you're a candidate, you can sign up for one of those sessions and they'll give you a lot of great information, or you can just call the center and request a consultation. And if you qualify, if you're eligible, you can come and meet and greet with a member of our team, and they will talk to you about the options that would be best for you. So that about wraps up today's show. Again, if you missed the majority of today's show and our discussion with Dr. Patricia Andrade about our breast care program here at Morton Hospital, about screening guidelines and treatment options, you can find our shows online by searching on YouTube, Morton in the Morning, or we always post a link to our show after it airs on our Facebook page, facebook.com/Morton Hospital MA. We really appreciate Dr. Andrade for joining us today. It was a great show with so much helpful information and to raise awareness during Breast Cancer Awareness Month. And before we end our show, just another friendly reminder about how you can reach us here at Morton in the Morning. We would love to hear from our listeners at any time. If you have any feedback, if you have any follow-up questions from any of our shows, if you're looking for a resource, or if you have any suggestions for topics that you'd like to hear about on future shows, we'd love to hear about those as well. And you can contact us at any time. Our email address is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we check that email throughout the week, so please feel free to send us an email at any time. Share your ideas, your thoughts, or just let us know how we're doing and if you enjoy listening to our show. So once again, you're listening to Morton in the Morning, and we come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. We look forward to joining you again next week. Feel free to reach out to us at any time at our email address if you have any suggestions for anything that you'd like to hear about, any health and wellness topics, or any specialists that you'd like to hear about. And again, with regard to specialists, today we talked to Dr. Andrade, who practices out of our SMG Morton Surgical Office. If you'd like to learn more about the team at that office or request an appointment with any of our surgeons, you can call that office at 508-824-4535. Again, that's 508-824-4535. You can also find Dr. Andrade and the team online at mortonhospital.org and search our Doctor Finder tool, where you can also request an appointment online. Thank you again to Dr. Andrade for joining us today. Thank you again to all of our listeners for joining us. And that wraps up today's show. So we look forward to joining you next week. And from all of us at Morton Hospital, we hope you have a happy and healthy week. If you're looking for weight loss that lasts, look no further than the Steward Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.